Good morning, everybody, and welcome to our monthly webinar. This month, we are focusing on managing healthcare expenses in retirement. And for those of you who are new to us, we are Elevate Wealth Advisory. We are a wealth advising firm in Athens, Georgia, and we were founded 30 years ago, this month 40 years ago, this month by Chuck Vickery. Chuck established us as Vickery Financial Services in 1982, and his goal was to help people make smart decisions with their money. And our team has grown, our name has changed, but one thing stays the same, and that is our core values of helping people make smart decisions with their money and giving you wealth advice for your best life. So today we are very pleased to bring Chuck Vickery, our founder, to you as he will discuss how to manage your healthcare expenses in retirement. Hi, Chuck.
Good morning, Betsy. Hello, everyone. This is a topic that every person in America eventually will be concerned about, because eventually everybody's going to receive benefits from two of the largest government programs, Social Security and Medicare. But navigating these bureaucratic agencies is not easy, because we don't deal with the government on a daily basis. Because of COVID, there's reduced staffing. Training has not been quite as good. So when you try to get in touch with either one of these agencies, you get a long telephone hold, and you may even get some incorrect answers. Now, this is not only frustrating, but it's also leading people to maybe making some bad decisions. So as part of our Blue Ribbon Gold Medal 24/7 continuing service, we're trying to save people time and hassles by accurately answering both Social Security and Medicare questions and providing solid math-based solutions and recommendations unique to everybody's own situation. The baby boomer generation is seeking to get the most out of these two programs that they've paid into for all their lives, and whose benefits they're just now beginning to understand. So we're going to talk mostly today about Medicare. David Jenkins, another advisor, did a webinar last month on Social Security. We've partnered with a firm in St. Louis called First Element that does insurance. They did a long-term care webinar a couple of months ago. So we have on here our website, www.elevate-wealth.com. If you go to that, scroll to the bottom of the first page and hit YouTube, all the webinars that we have done are there, and you can go see them. So today we're going to talk about healthcare expenses, primarily Medicare, and I want to go over 3 points. Point number one, if you do not enroll in Medicare on time, you're going to have to pay a penalty, and nobody wants to do that. Number two, if you do not get the right private insurance to go with Medicare, you may pay too much in premiums or out-of-pocket costs. And then number three, if you do not plan for higher health costs in retirement, you could run out of money or not be able to get the care that you need. And we don't want either one of those to happen. So let's look at our agenda today. What is Medicare? Who needs to enroll in Medicare, and when? And how do you enroll in Medicare? We're also going to talk about how much does Medicare cost? What does it cover? What does it not cover? And how does private insurance work with government insurance, which is Medicare? So there are a couple of reasons that healthcare expenses will be higher in the future. One is inflation, which has come roaring back, and we all know about that. But as you age, there's an increased need for services. And keep in mind, Medicare does not cover long-term care. So let's talk a little bit about enrollment. When do you enroll in Medicare? And how are your health insurance costs covered? Well, before age 65, most people either have group health insurance provided by the employer, or they've already retired and taken their insurance with them, but they're not yet 65, or they've terminated employment and they're continuing their group health insurance under COBRA, which you can do for 18 months, or they have individual health insurance, or maybe they're just self-insuring, whatever. But once you hit age 65, you're eligible for Medicare. And what's important about that is Medicare pays first. So if you have retiree health insurance, if you have COBRA, if you have individual health insurance, they may not pay because they instantly become a supplement to Medicare. And if you don't have Medicare, you got a problem because all those other insurances pay second. So what this means for you is that unless you're covered by an employer group that has at least 20 or more employees covered, you must enroll in Medicare when you turn age 65. If you're working for a large employer with 20 or more, you can wait until you terminate employment, and then you can enroll in Medicare. And if you don't enroll on time, there are late enrollment penalties. And typically this is 10% per year. So if you're 65 and you're healthy and you think, I'm going to wait until I get sick to enroll, you can sort of do that, but you're going to pay a penalty, and it's 10% a year, and it's 10% a year for life. During this time, your healthcare expenses may not be covered, and your private insurance options may become limited because you did not take advantage of them at the time you turned 65. So what is Medicare? It's basically our national social health insurance program for people 65 and older. It's administered by the Centers for Medicare and Medicaid Services, which is associated with the Social Security Administration, and you actually enroll through the Social Security Administration. And everyone over 65, all citizens, all legal residents who've been here for 5 years or longer, and even some people under 65 who are on Social Security disability qualify for Medicare. And when we talk about Medicare, what is it? Well, it's different parts, and it's 4 parts. Part A is the part that covers the hospital. Part B covers the doctors and various tests. And you'll notice these are provided by Medicare, which means these are governmental programs run by the United States government. There's also private insurance, and that's sort of what makes this a little bit tricky is we've got government insurance and private insurance. Part C is called a Medicare Advantage plan, and it's provided by a private insurance company. Part D is a Medicare prescription drug coverage plan. And Part D can work in conjunction with A and B or Part C, but both of these are private plans. And how we normally see these put together is 2 different ways. Original Medicare, you enroll in Part A, and Part A is free. You don't have to pay for that. Part B is not free. You do have to pay for that. And the cost is essentially the same for everybody, but there are exceptions to every rule, and we'll talk about the exception to cost. And then you can add Part D to cover your drugs. And most people that do this also add a Medicare supplement insurance policy through a private insurer. The other option, option 2, is a Medicare Advantage plan. It costs exactly the same as original Medicare. You have Part A, you have Part B, and normally it covers Part D. So the difference here is you really aren't paying for the Medigap insurance. The coverage may not be quite as extensive, but it's a little bit cheaper. Well, how do you enroll in these plans? Well, if you're receiving Social Security when you turn 65, Medicare Parts A and B are automatic. You can decline if you don't want Part B. So if you're still working and you want to continue your employer insurance, you can sign up for Part A, and that'll help you out some. And then you can wait for Part B until you quit working, assuming you're working for a large employer. Coverage begins, the the first of the month. So the first day of the month, you turn age 65. So my birthday is August 24th. My coverage started August 1st, the month I turned 65. So A and B are automatic. Part C and D, you have to choose a private insurer and you have to proactively enroll in them. So that's for people who are receiving Social Security already when they turn 65. If you're not receiving Social Security when you turn 65, you must sign up through the Social Security Administration during a Medicare enrollment period. So the initial enrollment period, if you're not covered by a group plan at 65 is one thing. Then there's the special enrollment period where if you are covered by a group plan, and then there's a general enrollment period if you just never signed up or if you forgot to or if you missed it for some reason. So let's go back and talk about the initial enrollment period that impacts most people. When do you sign up? You can sign up 3 months before you turn age 65. And we would suggest that you do that. And the coverage begins on the first day of that month that you turn 65. If you wait until 65 to sign up, the coverage begins the first of the next month. If you wait a month after you're 65, it begins 2 months after you sign up. And if you wait 3 months afterwards, it takes 3 months to sign up. So I always encourage people, and I'm on Medicare, so that's why they let me do this. And quite frankly, I'll say this, I've been very happy with the coverage that it has afforded me. But I always tell people, go ahead and sign up as soon as you possibly can if you want it to become effective when you're 65, and if you're not working for a large company that has over 20 employees on their group insurance. So you can do this and you don't face any penalties and you don't lose any coverage. You don't go any time period without coverage. So who signs up for Part A during the initial enrollment period? Almost everyone. So check with your administrator if you're still working and covered by a large group health plan. You may be advised to enroll in Part A to enhance hospital coverage offered by the employer. Now, there's a big if to this. However, do not sign up for Part A or Part B if your employer plan is large and it is a high deductible health plan paired with a health savings account, and you want to keep contributing to the health savings account. Once you sign up for Part A or Part B, HSA contributions must stop upon your enrollment in Medicare. So who signs up for Part B? People who are not covered by a comprehensive employer-sponsored plan that covers 20 or more people. So basically, that's if you're not working, if you're self-employed, if you're employed by a company with less than 20 employees, if you're on COBRA, if you're receiving retiree benefits, or if you're employed by a company whose health plan is less comprehensive than Medicare, then you need to sign up for Part B. And that basically is everybody that doesn't have good coverage under a large employer. So we got Part A, we got Part B, we got Part D. Who signs up for Part D during the initial enrollment? People. Basically, people that have signed up for Parts A and B and want prescription drug coverage either now or in the future. And if you sign up when you're first eligible, there's no late enrollment penalties. Now, if you're covered by your employer and you've got a good drug coverage, you don't have to do this until it's time for you to leave your employer. So there are two options for Part D. One is a standalone prescription drug plan that goes with A and B. And the second one is a Medicare Advantage plan that includes drug coverage. So when you're 65, I recommend you sign up 3 months early. And then that way the coverage starts the first of the month you turn 65. The only reason I think of you would not do that is because you're working for a large employer and you want to continue that coverage into the future. So that's the initial enrollment period. There's a special enrollment period. And this is for people who did not sign up for Parts B and D during the initial enrollment period because they were working for a large employer. So when do you sign up for Part B? Well, anytime before your coverage at your employer ends. Now, I don't recommend keeping your employer coverage and Part B because you're just going to pay for two plans that are not totally coordinated. So, but you also have the opportunity to sign up in the 8 months following when your group coverage ends. So there is a little time lag there. But if you do this, you get it without penalties, and you get your coverage, and you can buy the supplemental policy without underwriting. There's no questions asked. And then special enrollment in Part D is you can sign up for that anytime before the coverage ends, but you have to do that within 63 days after you leave your employer and that coverage ends, or there will be some penalties involved. What's the best time to enroll in Medicare? Well, to avoid late enrollment penalties, sign up during the initial or the special enrollment period, and to avoid gaps in coverage, sign up before your current coverage ends. If you don't, there is a thing called a general enrollment period. So if you miss the initial enrollment period, then you can sign up during the first quarter of the year. So right now it's October. If you want to enroll in Medicare because for some reason you forgot it and you're not within the guidelines, you missed it by a year or two, then you can't sign up until January. So during the first quarter of next year, you can sign up, but the coverage does not become effective until July 1st of the next year. And you get to pay a 10% penalty for every year that you waited. So you can sign up if you missed it, but there's a delayed benefit. So you can't wait until you get sick and say, I'm going to sign up for Medicare and I'll have coverage next month. No. Right now, you've got to wait like 9 months before you're even eligible. So let's just sort of review the enrollment periods. Initial enrollment is when you're 65. The best time to sign up is 3 months before your birthday, and it starts on the first of the month that you turn 65. The special enrollment period is for people who are covered under a large plan, and the best time to sign up is before that coverage ends, and the coverage starts the first of the month if you enroll no later than when the coverage ends, or the first of the month following the enrollment if later. So you want to sign up for both of these. And then the general enrollment period, you can sign up first quarter, January 1st through March 31st, and that coverage begins on July the 1st. So how do you sign up? Well, you can go online to the Social Security website, which is www.ssa.gov, apply for Medicare benefits, or you can call Social Security at 800-772-1213. So either one of those will work. I signed up online. It's not that difficult to do. Now, if you just want some general information about eligibility, you can go to medicare.gov/Medicare eligibility. So that's how you sign up. How do you sign up for that's for A and B. How do you sign up for Part D? Well, if you decide you want original Medicare, the A and the B and the D, then shop for a standalone prescription drug plan. Now, the way I would suggest you do that is go to medicare.gov and put in your address, put in the drugs that you're taking, and they'll show you all the companies in your area that sell a drug plan and what the benefits are and what it costs. If you aren't taking a lot of drugs, you might just buy the absolute cheapest plan that you can find. Some are as low as $8 or $9 a month. But that way, 5, 10, 20 years down the road, when you do have a need for a substantial amount of drugs, you don't have to pay any penalties for buying it. If you go with Medicare Advantage plan, the Part C, just make sure that they have drug coverage and shop for that plan. Again, you can go to medicare.gov and you can actually enroll in a Part D that way. So let's talk a little bit about Medicare and private insurance. So what we know is that when people retire, the average is about $5,460 a year that they spend on cost of care. That's co-pays, deductibles, cost of insurance, prescription drugs, eyeglasses, dentistry, long-term care, everything. If you average it out, it's about $5,400 a year. And as we age, that cost goes up. So the out-of-pocket cost that you pay, a good friend and client retired or became 65, and his son-in-law said, "Great, now you get free insurance." Well, unfortunately, Medicare is not free. You do pay premiums for Part B, and you pay premiums for the drug part. And if you get a Medicare supplement, Medigap policy, you pay for that. Many Medicare Advantage plans have a cost. And then you have other out-of-pocket costs like deductibles, doctor's bills not covered, and then services not covered by Medicare. So what do these monthly premiums run? Well, Part A is no cost. If you remember, if you're still working, look at your check and it's got that little Medi on there where they take 1.35% of your pay. That's what covers Part A. So people that are working pay for Part A. People that are on Medicare pay for Part B. It's $170.10 a month. In 2022, it'll probably go up to $180, $190 next year because of inflation. I started on Medicare 10 years ago and it was $99.90 a month. So it's gone up just about every year. And then when you do Part D with a private insurer, that varies with the plan and the benefits that you select. So you'll notice under Part B and Part D, it gives a cost, and then it also says plus income related adjustment if applicable. So what we're finding, this is called IRMA. This is your monthly or your annual earned income. And you'll notice here we've got MAGI, that's modified adjusted gross, single and joint. So basically what that is your income, and they add back certain things to it, like if you're still working, your 401k contribution that you don't pay taxes on is added back to your income, or your IRA. But if your income, if single, is less than 91,000 or married jointly less than 182,000, that's when you pay the $170.10. If you get a drug plan, for example, we use $40. That may be high for you, that may be low, that's a good average cost. So you're going to pay about $210 a month per person for Medicare. However, if your income is higher, for example, if you're single and your income is $91,001, just that $1, then all of a sudden you have to start paying what we call an income related adjustment. And that's $68 a month for Part B. And then for Part D, it's an extra $12.40. So we're talking about roughly $1,000 a month. And if you make a lot of money when you retire, if you look at that bottom line, above 500,000 for a single, above 750 for a couple, you pay a $408 additional premium for Part B and a $77.90 additional premium for Part D. So you're looking at about $6,000 a year in extra money. So, and how they do this is they go back and they look at your income from 2 years ago. So right now they're looking at the 2020 income to determine how much you pay for Medicare. Well, why didn't they use the 21 income? Well, it's simple. You didn't have to file it until April, and they had to adjust the premium in January. So that's why they go back 2 years. Now, if you make more than one of these categories, there is a form, let me see if I've got it on here. Yeah, it's called SSA 44. And basically what you can do is you can tell the Social Security and Medicare system that, hey, I've had a life-changing event. And the one for most retirees is work stoppage, which means you quit working. So if maybe your income was $250,000 and you fall in the middle of this thing, but when you retire, your income is going to be $150,000. Well, if you tell them that on this form, then they will allow you to avoid paying $200 per month in extra premiums. So this is the form SSA-44. If you need it, you can Google it or you can call us and we can email it to you. But this is the form when you first start to make sure you're not overpaying. So there are some deductibles that you have to pay. There's a deductible per illness. For Part A, there's a deductible for Part B, and there's a deductible for Part D. So it doesn't pay for everything. And this is why people a lot of times will get these Medigap policies. It covers these deductibles for you, at least on A and B. So, and then there's co-insurance. It doesn't pay for everything. So again, the Medigap policy comes in and it fills in all these gaps. Again, I've been under Medicare for 10 years. I'm doing original. I've got AB and a Medigap policy. I have yet to pay one penny other than premiums for Medicare, for medical services, surgery, or whatever for me or Patsy. So under the Part D drug plan, there's deductibles there, and then they pay parts. So I spend more money here than I do for doctors and hospitals because you do have some out-of-pocket cost here. And the insurance is very expensive if you want it to cover everything. And I don't think any of these drug plans actually cover anything. So what it does cover is Part A covers the hospital 100% for the first 60 days after your deductible. Medical services, doctor's visits, outpatients, that's Part B, that pays 80% of the cost. And it covers some preventive shots like flu shots and various screenings. So again, if you get the supplement policy, it takes care of anything after 60 days in the hospital. It takes care of the 20% that Medicare does not cover. And speaking of not covering, it does not cover long-term care. It does not cover you when you're outside the United States. Doesn't cover dental, doesn't cover vision, doesn't cover hearing aids. I think they're going to add hearing aids to this. It's something they're talking about right now. Cosmetic surgery, acupuncture, amounts over the approved amount by Medicare, and amounts not covered by the deductibles and the co-insurance. So it doesn't cover everything. So again, the supplemental policy helps, but it doesn't cover all of this either. It doesn't cover the dental or the vision or the hearing or cosmetic surgery or the acupuncture, but it does cover a lot of things. So when you get a supplemental policy, it covers the deductibles and the co-insurance amounts, the Part A deductible, hospital cost after 60 days, the 20% that Medicare doesn't pay, and amounts that are charged over the Medicare amount. Prescription drugs, it may cover the deductible. That depends on the plan that you buy. And it covers the cost of most certain drugs once you've satisfied your deductibles there. These Medigap policies are private health insurance policies. They're coming from private insurance companies. They supplement the original Medicare coverage parts A and B. If you buy this when you're originally eligible, that 7-month window, 3 months before you turn 65, 3 months after you turn 65, no underwriting on this. Or if you're coming out of the special enrollment period where you've been covered at work, you can still qualify for these policies and you don't have to have evidence of insurability. Okay. And these policies follow federal laws that protect you. They only sell a standardized Medigap policy, and it's identified by letters. Now, these policies do not work with Medicare Advantage. So there's no reason if you're on a Medicare Advantage plan to have a supplemental policy. You pay a monthly premium and the costs vary by plan, company, and location. So let's talk a little bit about plan and company. Location is where you are. So here are the plans, A through N, and this shows what they cover. So we used to tell people to buy plan F because it was the most comprehensive. Well, now we're telling people to buy plan G because F is no longer available. And the difference in the two is that with plan F, it covers any Medicare deductibles. Plan G does not. You have to pay that $200 deductible. The good news is the premium for plan G is more than $200 less than plan F. So it's actually a very cost efficient plan. But you can here they are. We're recording this, so you can come back and look at this, or you can call us and we can send this to you. But these are all the different plans. And then you just want a good, solid insurance company. We don't sell these, but there are people that do. So you just you want to find a good company. The price on these does go up as you age. Mine started at about $150, and I think it's at about $250 a month now. So they're going to keep going up. So keep that in mind. So Medicare Advantage plans, they're plans that are approved by Medicare. They're called Medicare Part C. They are a private insurance company. The government, if you sign up for one of these, the insurance company gets about $1,800 from the government for everybody they sign up. So if you've been watching TV lately, you've seen Joe Namath and Jimmy Dynamite Jackson, or whatever his name is, encourage you to call and see if you can get money back and this, that, and the other. The less you pay for a Medicare supplement, probably the lower the coverage. Normally, it's like a PPO, preferred provider network, or an HMO, health maintenance organization. They have a network of doctors, and you have to go to those doctors, or they don't pay. It may include prescription drug coverage. It may include benefits for vision or dental. There may be some other benefits in there. So the nice thing about these is they normally cost less than the original Medicare, where you have A, B, D, and a supplemental policy. The problem with these, a friend of mine calls them Medicare Disadvantage policies. The problem with these is you have to go to that network of doctors. And if you get cancer and you want to go to MD Anderson in Texas, they may not cover it. If you need a heart valve and you want to go to the Cleveland Clinic in Ohio, they may not cover it. If you need to have some brain work done and you want to go to Johns Hopkins in Baltimore, they may not cover it. Where you can do that with the original Medicare. Okay. So the Medicare policies are standardized, so we want you to shop carefully and get a policy that with a good company, a good reputable company. Obviously, cost is important, but necessarily the lowest prices may not be the best. So you want to get as comprehensive coverage as you can. So that's right now it's Plan G. Drug plan benefits vary considerably. So take a look at those and make sure that the drugs you're taking, the medicines you're taking, are covered. And Medicare Advantage plans vary considerably. The cheaper the plan, normally the lower the benefits. The other problem we see with Medicare Advantage plans is that as you age, when you get up into your 80s, they sort of get a little bit slower in approving some of the things, some of the surgeries that you might need. They drag their feet a little bit because these companies are in it to make a profit, and they make a lot of profit on 65 and 70-year-olds. They don't make a lot of profit on 85 and 90-year-olds. And if you can afford it, my way of thinking, the original Medicare with A, B, Part D and a supplemental policy is better. But if cost is of concern, make sure you do some shopping around. There are a few 4- and 5-star Medicare Advantage plans. Shop for one of those if there's one in your area. So, and because costs go up, we have to plan for that in the future. So here's a chart that shows the average cost is, as I said, is $5,460. But if you look at men under 65, it's about $2,800. Men 65 to 74, it's almost $5,000. Men 75 to 84, it's over $5,000. And then 85 plus, it's almost $10,000 a year. And the numbers are very similar for women. Under 65, $2,800, 65 to 74, $5,000, 75 to 84, about $6,000, and over 85, about $10,500. So you're going to see costs go up in the future. And what's important about this is make sure your retirement plan has some assets in it that will grow with inflation and maybe beat inflation. And obviously we do a lot of asset planning and a lot of investment management for our clients, and we build that in to our plans. So when you first start, if you're age 65, Part B premium is about $170. The Medigap premium is about $200. Part D is $40. So you're looking at about $400 a month per person once you turn 65 and you're on Medicare A, B, and D. So if you take the cost and then you look at your out-of-pocket costs for prescription drugs, for dentistry, for vision, alternative care product, it's about $6,500 a year. So when we're doing our planning, we like to average about $12,000 to $13,000 a year, build that into the budget and make sure that your retirement income will support that. So we're going to have rising health costs, and that leads higher insurance premiums and higher out-of-pocket costs. And then a change in health normally requires more expensive prescription drugs and more services not covered by insurance, the dental, the vision, the hearing, alternative care, long-term care. So it's going to have an impact on your budget in the future. So both Fidelity and the Employee Benefit Research Institute did a study. What does it cost for a couple age 65 in out-of-pocket costs for premiums and care until death? And Fidelity came up with a number of $300,000. Employee Benefit Research, $296,000 for couples. So that's average. You may be a little worse. Hopefully you're a little better. But again, you've got to have your portfolio set up so that it can give you cost of living increases as we go down the road. Okay. And then planning for long-term care. It's not covered by Medicare. It's not covered by Medigap. If you need skilled nursing care, it will cover you after a 3-day, Medicare will cover you after a 3-day hospital stay for 20 days. The next 80 days, it's like a $200 per day deductible. And then after 100 days, it doesn't pay for anything. So don't count on your Medicare for your long-term care. Now, early on, I said, if you go to our website, elevate-wealth.com, scroll down to the bottom, there's a YouTube button, hit that. There's about 4 months ago, we had a gentleman from First Element, which is an insurance agency in St. Louis, gave a real nice presentation, and it's recorded on long-term care if you'd like to look into that. Okay. And why do we want to plan for that? Well, spare the family members the burden of caring for you, avoid having to spend down your assets and go on Medicaid, which is for the indigent, not Medicare, and then be able to pick and choose and direct your own care and obtain the kind and quality of care that you want. So we've talked a lot about Medicare and different things, but there's 3 reminders. Number 1, enroll in Medicare on time. Number 2, shop carefully for private insurance to go with your Medicare. And number 3, plan for higher health costs in retirement. I want to thank you for watching today. If you have any questions, there's a little button you can hit, or chat button or question button. Help me out, Betsy. What's that button called?
Hi. So at the bottom of your screen, there's two boxes. One is the chat box, and it's a little thought bubble. You can click that and type in a question. Or if you go over to the right at the bottom of your screen a little bit, you'll see Q&A. You can type in your question there and we'll answer it. But Chuck, this is the third year I've seen you do this presentation, and every year the information is more thorough and I learn even more little tidbits every year. So thank you for continuing to do this presentation year after year for us. One question I personally have is, what can people do to ensure that their income throughout the year doesn't go over to the point where their Medicare premiums go up? How is the best way to monitor that?
Oh, that's a tough one, Betsy. The best thing to do is to sit down with your advisor, to send your advisor a copy of your tax return, because it's hard to do planning, just tax planning, without a copy of the tax return. But that's something that we look at. And let's look and see how tax efficient your money is. Is there something that you can do before you're forced to take your required minimum distributions to maybe convert some of it to a Roth, or just take some of it out and put it in a joint or individual account, or some way that we can lower those required minimum distributions? There's a myriad of things you can do, but without looking at that tax return, it's difficult. And it's not very much fun when you make $10 or $20 or $30 over the limit and you get to pay an extra $1,000 for you and your spouse because of that, when a little bit of planning in advance could have done that. One of the things that, the market's been down a little bit. So one of the things we've been doing is tax loss harvesting, which is trying to make lemonade out of these lemons. But if you sell an asset while it's down and buy something that looks just like it, you can write off some of that loss and you're still invested. So when the market comes back, you're right there in it, and it's your portfolio still protected and participating. So tough question, Betsy.
Well, it's just interesting how everything works together. Everything from your, Social Security and your required minimum distributions to your charitable giving, all of it works to bring those Medicare premiums down in the long run. So,
right.
One question we have: so, is there never a case where Medicare will cover long-term care?
It covers it for 20 days following a 3-day hospitalization. And it covers it for the next 80 days, and there's a deductible per day. And I think the deductible is close to $200 a day. So there's not the cost might be $250 or $300 a day. So it covers very little. But
well, like you said, that presentation that was given, it was Michael Tesler with First Element. It is on our YouTube channel, and it was pretty thorough, talking about long-term care insurance, when to start planning for it, why is it necessary. And so it is great information. I'm going to go ahead and share my screen for a second. All right. Can you see my screen?
I can.
Okay. So I wanted to share all the different ways you can learn more about all these different subjects. Like Chuck mentioned, here's our YouTube channel. And when you go to our YouTube channel, search for Elevate Wealth Advisory Athens, Georgia, so you make sure that you get us. And you'll see there's Chuck talking about Medicare and private insurance in his weekly WealthWise for this month. But you'll see all of our WealthWise videos, which are short little 5-minute long presentations about various topics, from everything from Social Security to managing healthcare expenses to long-term care, anything you can think of, we've got there. And then if you scroll down a little further, you'll see all of our webinars. So you can go back and see webinars you may have missed. Last month was Social Security. The month before that was the long-term care planning. Those are great. And then if you scroll down even further, you'll see just different topics that might be of interest to you. Of course, you can find us on Facebook under Elevate Wealth Advisory. You can find us on LinkedIn. You can even find us on Instagram. So, we're up with the times here at Elevate Wealth Advisory. But the best place to look for information is our website, elevate-wealth.com. And of course, if you have any questions for Chuck that you didn't get to today, you can email marketing@elevate-wealth.com. And we'll go ahead and make sure Chuck gets all those questions answered for you.
All the advisors here are pretty well versed in Medicare and Social Security and taxes. So if you've got any questions, I'll be glad to answer them, or you can just call your advisor and say, hey, I want to come in and just chat with you. Let's talk about this. So.
Very good. Well, thank you so much, Chuck. And next month, we'll be focused on year-end planning. Rob Fazekas, one of our wealth advisors, will be going through a checklist of different things that you might want to start thinking about as we near the end of the year, just to make sure that you hit that 12/31 deadline of anything you might need to accomplish. And then Chuck's going to join us again in November to talk about philanthropy and charitable giving. That's always a great webinar, just full of wonderful information about things you might want to think about doing at the end of the year to make sure that when you're giving, it also can benefit you tax-wise. Well, Chuck, thank you as always for all of the information you've shared, and we'll see you soon.
Sounds good. See y'all.
Bye.